Transplantation, and for this session I would like to call upon the chairpersons for this session, Dr. Ashok Agarwal sir. Sir is past National Vice President IMA and an esteemed surgeon of our city Prayagraj. Dr. Alankar Jaiswal. Dr. Alankar Jaiswal is ex-assistant professor in MLN Medical College in Department of Urology, and currently he is consultant at Central Railway Hospital, Prayagraj. Dr. Soumya Gupta. Dr. Soumya Gupta is a young promising nephrologist of Prayagraj, and she is assistant professor in Department of Nephrology in MLN Medical College, Prayagraj. I welcome you all. I request our speakers, our chairpersons, to kindly introduce the speaker. Thank you.
Good evening, everyone. I would like to invite our main speaker. And I'd like to invite Dr. Sanjeev Gulati, sir, for the talk on renal transplantation. He's the chairman, nephrology and kidney transplant department at Fortis Hospital, NCR. He is the ex-vice president of Indian Society of Organ Transplantation and member governing body of Indian Society of Nephrology. He is the fellow clinical nephrology from Toronto Hospital, Canada. He has many national and international awards and publications to his credit. He has a public awareness talk on world first multilingual educational resource on corona. So welcome, sir.
Thank you, and good evening, friends. At the onset, I'd like to thank Allahabad Medical Association for inviting me here, and also compliment them for organizing this excellent program on kidney diseases. So, I think, can we have this? Right, so I'll be talking to you about kidney transplant, an odyssey. First of all, kidney transplant is currently the gold standard for stage 5 chronic kidney disease. And not only that, now there are several recent advances about kidney transplant. So we are doing pediatric transplants, and the age is getting blurred. We are doing geriatric transplants. We have done transplants right up to 75, 78 years of age. Previously, blood group match used to be one of the important limitations, but we can do that now. We can do paired kidney exchange. We can do kidney transplants in HIV positive patients. Kidney transplants are done even during COVID, which is quite paradoxical because COVID was a state of infection, but we realized soon that actually transplant patients did better than, and combined liver kidney transplant has been done in primary auxiliary by us. But first and foremost, when I talk about kidney transplant, I tell my patients that kidney transplantation is like marriage. It means benefits for many, curse for some, but definitely risk for all. So you need to be careful. Once you have had kidney transplant, you need to, be compliant with the medications. You need to follow up with your doctor regularly, and you can't take things for granted. So end-stage renal disease cannot be treated with conventional medical treatments like drugs or alternative therapies which are widely advocated on the social media. And there are only two treatments which can allow you to continue living. One is dialysis and the other is kidney transplantation. Now, how do you compare both? Well, the annual mortality rates for patients on dialysis range from 21 to 25%, which means that if you start 100 patients on dialysis today, at the end of 1 year, you will have 75 which are alive. In contrast to that, if you have done a cadaveric transplant, 92 will be alive. And if you have done a live-related transplant, which is what we do most of the time, 96% of our patients are doing well with normal renal function at the end of 1 year. We are no longer talking about immediate success rates. We are talking about 1 year or 5 year or 10 year, as I'll tell you. And healthier patients generally are selected, so there's no doubt about it. And benefit is most noticed in young people and especially those with diabetes, because in diabetes, as we all know, is a comorbidity, as a disease with a lot of comorbidities. And if you were to transplant a non-diabetic individual, dialysis, if he goes on dialysis 20 years, a transplant at least 31 years of life. Diabetic survive very poorly. They do survive only about 8 years on dialysis, but the moment you do a transplant, at least 25 years, if not longer. And some of these data, the statistics are old, we are doing better by the day. So for end stage kidney patient, there is no doubt that renal transplantation is a breakthrough, and transplantation science is not new to us. We know that in our Hindu mythology, Lord Shiva transplanted the head of an elephant for Lord Ganesha. So, transplantation offers potential improvement in quality of life and patient survival. And our goal as a nephrologist is to avoid rejection, minimize complications, and optimize long term graft survival. How do you select a patient for kidney transplantation? Well, all patients with stage 5 kidney disease or end stage renal disease should be told that you should undergo transplant unless there is a malignancy. And if the malignancy is cured and is recurrence free for 2 years, then you can still go ahead with transplant. So this is also relative now. Chronic infection like tuberculosis, so first treat the infection. 2 months, we follow a 1 month rule, sorry. So 1 month after starting therapy, we go on for a kidney transplant. Severe cardiovascular disease, which requires attention first because of risk of anesthesia. So if if they want to go for a bypass surgery or a stenting, this needs to be fixed, but thereafter they can go. Neuropsychiatric disorder is perhaps the only one where we counsel our patients against kidney transplantation because they have to take lifelong immunosuppression. And if they forget to take that, there'll be a rejection and a kidney will go waste. So this is where, and all our patients, before they undergo a transplantation, undergo a detailed psychiatric evaluation by an independent team who certifies that this patient is fit enough. Extremes of age, I said, is getting relative, and I will show you over the next few slides why it is so relative. So, what are the principles? Well, as of now, there is lifelong immunosuppressive therapy, but the benefits outweigh the risks. And we use multi-drug regimens, large doses initially, but as time passes, there is accommodation. So the doses come down, the cost also of immunosuppression does come down. Now, this is another $1 billion question as to who can donate. Well, as per the Human Organ Transplantation Act, in our country we can only take a blood relative, which is a first degree or a second degree donor. He has to be highly motivated, excellent medical condition with normal renal function, has to have a negative cross match, which means that there are no antibodies in the patient against the donor. Blood group is preferable, but even if there is no blood group match, we can still go ahead now. So, and this is one of the recent, advances. HLA match previously we used to look for, but today, because of the availability of excellent drugs, HLA matching is not really essential, and anybody can really donate, provided the committee permits. And these are the major barriers. As I said, the HLA antigens which were overcome. But yes, if you have anti-HLA bodies, you need to undergo desensitization. So there also in sensitized patients, technically we can do that. If there are blood group mismatch, they have preformed antibodies, we can still do that. Interspecies differences, and this is where the change has come. Some of you might be aware that now we are, for the first time in US, genetically modified pig kidneys have been transplanted successfully into humans. Preemptive transplant, I think this is what it means, going ahead for kidney transplant without dialysis. And this gives you the best success rates. It also cuts down on the cost that you would be spending on dialysis. And this is one such child who we transplanted at 4 years of age, in the preschool period. He is now 17 years post-transplant. He is on TAC as a alternate day prednisone, which is the immunosuppression. No rejection till date. His mother donated. Serum creatinine of 0.5, and as you can see now, this is his recent picture when he completed his graduation. One of the other challenges is, in a girl child, and this is one such patient that I managed when I was in Lucknow. She was a 14-year-old schoolgirl at that time. The family was undecided, had chronic kidney disease, stage 5, had spoken to a few leading nephrologists in Delhi who had counseled them against transplanting just because she was a girl child. Because what would happen to her later on? I'll tell you a story. It was just remarkable. So we put her on dialysis. She developed tuberculosis. She used to vomit on dialysis, poorly tolerated. And that time the family started rethinking about kidney transplant. There were two major issues. One was the social, which I already discussed. They were not sure what will happen to her later. Second was finances. Donor was not an issue. Mother was ready to donate. For the finances part, we did some crowdfunding. I spoke to a school, and generously the entire school came around, and the money was collected by the students, and we had the funds ready in no time. So 2003, 22 years back, she underwent her transplant. And this is an academic journey. She did her bachelor's in engineering, she did her master's from IIT Kanpur, and currently is a faculty at IIT. Not only that, she got married. Now, kidneys have they can't last infinitely, and as you can see, about 19 years later, she came back to me that the graft was failing. So I told her again, there are only two options: you go back to dialysis, or we look for a donor. She was lucky; her husband consented to a transplant, and her creatinine, which is so she underwent transplant about in October 2022, so 2.5 years back. Currently, serum creatinine of 0.8, and she is working, also supporting her parents' um, medical challenge. So this is a young boy who came all the way from Cambodia to Delhi. He had failure to thrive since 2 years of age, could not walk, poor appetite. Uh, so at that time he was 4 years, but he looked more like a 2-year-old boy. So the first 3 months we had to stabilize him, get his nutrition up to date. We put him on peritoneal dialysis, and once over the next 3 months he stabilized. In 2012, he underwent a kidney transplant, and this is he was one of the youngest to undergo a kidney transplant. This is his picture at that point of time, and this is his subsequent picture. He is now happy with his father, attending school, and doing well. Going on to the other extreme. So this is a 78-year-old physician, a former professor and head Department of Medicine in Regional Institute of Medical Sciences, Imphal, which is in the state of Manipur. A picture I took, I think I was visiting Imphal just last month, and he just came over to say hello to me, and he had developed end-stage kidney disease, and he came to us. He was very clear that he was 75 years old, and he said, I want to go ahead with a transplant. So I told him that there are risks involved, the risk of immunosuppression, but he said, I don't want to go through dialysis. So he's now 3 years post-transplant, 78 years old. Look at his state, and he does his OPD practice back to his schedule. So this is how miraculously kidney transplant transforms lives. There's another child that we transplanted first when he was, I think, close to 2 years, and he had renal vein thrombosis. This was, but the family was undeterred. The finances were never an issue, and they underwent a second kidney transplant in September 2005. This was again when I was at SCPGI. Was subsequently developed one unusual infection called BK virus. He has survived that. He also developed COVID in April 2020, and in fact his entire family developed COVID. Father was a diabetic, mother was, so he lost his father. Father didn't survive the COVID, but this gentleman, despite having a kidney transplant, survived COVID. He was obviously admitted with us, and he's 20 years post-transplant, creatinine of 1.7. Needless to say, he's got married, he's a father now, and he's also runs his family business. What about blood group mismatch? Well, this is a patient we transplanted. He was a small-time shop owner who had been on dialysis, and dialysis drains money. The cost of dialysis in 1 year is roughly the same as cost of transplant, and he had not found a blood group compatible transplant. So the only donor he had was his wife, who was blood group A. And when we looked at him, his titers were reasonably high, so we did plasmapheresis, and he underwent a ABO incompatible transplant. This is 2014. We are in 2025, and he just visited 2 months back, doing absolutely fine, earning for himself and his family to a useful member. So from a person who's dependent on his family for his finances, for a person who's a drain on the resources of the country, transforms these individuals to useful earning members of society who can contribute back to the society. We have done transplant in HIV patients. We evaluated 10 patients. 8 of them were fit enough to undergo transplant. one could not achieve viral suppression, so there are strict criteria, but they do, even these people do very well. Now, COVID time was particularly challenging for our transplant patients, and how to follow up these patients, because even the average person was fearful enough to step out of his home to the hospital, and these patients were scared. So we adapted. We started telemedicine with them, and this is a paper we presented at World Congress of Nephrology on the usefulness of telemedicine, where we could follow up, modify immunosuppression in these patients from the safety of their houses and comfort of their homes. So we were also the first group to restart kidney transplantation during COVID. This is a multicentric paper from India, published in Transplantation, the #1 journal, looking at question, is it safe to be transplanted from living donors who had recovered from COVID-19? So yes, sure enough, after they had recovered, we did the PCRs, and this was 31 centers, 31 kidney transplant patients from 19 different centers all over the country, including ours. And what we found was that they did well after they had recovered from. So it was safe to take donors who had recovered from COVID. What about patients? This is another study which we were involved in, looking at different patients, 75 recipients who had recovered from COVID. Should they go ahead with kidney transplantation? And the answer was a big yes. And the outcomes were 100% success rate, 6.6% biopsy proven rejection. And their outcomes were far better though on dialysis. We had a 25 to 30% mortality rate, across the board. So the learnings from COVID were the kidney patients were at high risk for COVID. Hemodialysis patients, there was a high mortality, 25 to 35% mortality. Transplant patients, did much better when compared to dialysis, provided you had followed standard operating precautions, and you could follow them up by telemedicine and bring to the hospital those patients who required urgent attention. And this is what I was telling you about xenotransplantation, which is the final frontier. So this procedure was conducted. The first one was done nearly a year back in Harvard Medical School, where genetically modified pig kidneys were transplanted, into the adults, and now 5 such transplants have been done, and I'm sure we are going to have a trial, and soon, in years to come, these genetically modified kidneys are going to be available all over the country. So to sum up, end-stage kidney disease is a going problem. Transplantation is the treatment of choice. Development of new drugs and new ways to combine drugs continues. We have very low acute rejection rates now, less than 10% in the immediate post-transplant period. Long-term survival rates are very good. We are talking about 5 years survival of more than 80% now. We need to tailor immunosuppression as per the risk profile, and we can do transplants whether the blood group match is there or HIV is there. Now, one of the biggest challenges that we find, I'm sure or you also find in your practice, is these alternative medicine practitioners. Many times these patients have come to us where our transplant package costs 5 lakhs, where they have spent more than 3 lakhs on alternative therapies. And it is our duty as physicians, to educate these people. And this is, I'm sure you're all familiar if you go on the YouTube. And to combat this, to educate the literate, as I call it, I've started my own YouTube channel. I have 50,000 subscribers, 40 lakh views, 40 lakh educated people now, about the various aspects of kidney disease also now. And this is the former vice president who recognized our work on kidney transplantation, and I ended it on this note that by Robert Frost, that a lot has been done, but a lot more needs to be done, and we have promises to keep and miles to go before we sleep. Thank you.
Hello. Thank you, sir. This was a much needed talk. And is there any questions from the audience? Thank you, sir. Your talk was really needed for our city. As a city who is trying to start transplant, I think your talk has busted many myths like age. There are many people coming to us कि किस age पे हमारी age 50 साल है क्या हमारा transplant हो सकता है. The finances, a very important question about the ABO incompatibility. So I think till now we were only 5 of us counseling patients for transplant. After your talk, all 50 to 60 people present here confidently counseling patients to go for the renal transplant. Thank you so much, sir.
Sir, there is one question regarding the donor legalities. Sir, the first degree and second degree relatives, is there law changes between the states? Because in Bengal, West Bengal, the donor can be second degree relative, but in Uttar Pradesh, I think the second degree relative is not allowed. Only first degree relative is allowed. So, is there any
So health
criteria?
is a state subject. So by and large, even the the act, the Human Organ Transplantation Act says very clearly that second degree relatives are allowed. And even in Delhi, we are doing second degree relatives. But the second degree relative is not accepted at face value or by documentation, because in our country any document can be produced. So for that we are doing genetic profiling. DNA matching is being done, and only once the DNA profiling is there, the committee, there is an authorization committee. So the final, they are the have the final word on it, and they if the DNA matches, by and large, they do give the permission. No, the HLA matching, yeah, you can do, but now the law has become a bit more stricter, and they want the DNA matching. HLA match actually we used to do initially because it gives you both benefit medically and legally also. But you need to know that even in immediate family members, in brothers sisters, you may have only 25% HLA match. So to obviate that, they are going. The committee has recommended, in that act, DNA profiling now. So they say that you do DNA and then they look at those various allelic markers.
Thank you, sir.
Thank you, sir, for your very lucid presentation. I would now like to call upon President AMA, Dr. J.V. Rai, sir, Organizing Secretary, Dr. Anurag Singh, sir, and Secretary AMA, Dr. Ashutosh Gupta, sir, to kindly come on the stage and facilitate the speakers and the chairpersons.